Welcome to our Farm to Home segment with registered pharmacist Thomas McDowell with Rocky Mount Medical Park Pharmacy. Good morning.
Good morning, Sandra.
That's a mouthful.
I know. We can shorten it up. Med Park, Medical Park. We say Medical Park Pharmacy
Yes.
when we answer the phone. So Medical Park Pharmacy is fine.
Yes. What are we talking about today?
We're going to talk about seasonal allergies.
Oh gosh, that makes me want to sneeze right now.
And so it's that time of year, and today we have rain, which sometimes viewed negatively, but the positive is it does wash away some pollen. So this is the time of year where you're seeing the yellow dust everywhere on your car, on your porch. Exactly. Falling in the air.
But it comes right back.
It does. It doesn't take long at all to come back. Yeah, so it's a very short respite from that exposure, and so it's a seasonal thing where we see the heaviest amount of pollen. And there's also pollen in the fall, but the spring season when the trees and the shrubs are blooming is when we see that pollen, and that's the yellow dust you see, and it can be an irritant. So what happens is we're exposed to that when we go outside. Even just walking to your car, you're exposed to that pollen in the air, and it irritates the sinuses, usually mostly upper respiratory, but some folks that are very sensitive will have some chest involvement, but the symptoms can be really aggravating. And for some people, they can be really severe. So it's something that at the pharmacy we see a lot of. We get a lot of questions about it. And so we're going to talk about what some of those symptoms are and how to treat them, because they are treatable, the symptoms. You can't necessarily get rid of the allergies. For folks with severe allergies, you can see a physician and potentially have some strategies with allergy shots or different exposure therapies. But most people, are going the symptom relief route.
Oh, absolutely.
So, most folks know about the symptoms of allergies, and we'll talk about how to differentiate them from other.
That's what I was going to say. Things. How do you differentiate from the common cold?
And we're still, seeing COVID. We're kind of getting out of the winter season where we just had a ton of COVID, RSV, and flu, and some unidentified viruses that were causing a lot of upper respiratory and chest issues, breathing issues that were tested negative for everything. So how do we differentiate between the two? So allergies you typically see in the runny nose, the sneezing, sometimes a little congestion, but comparing it to a virus, the virus side, you might have some runny nose and congestion, usually not as much sneezing. And on the virus side, you're often going to see a fever, some achiness, some chills. Usually, the allergies don't usually come with a sore throat. You might have a scratchy throat from postnasal drip. That one can be a little hard to differentiate, but a really sore throat is not usually from allergies. If it's very, very sore, that's usually from the virus is replicating and irritating your throat. And so if it feels like you have knives in your throat, that's probably not allergies. COVID sometimes has that. Those symptoms, strep throat, which is bacterial infection, has a lot of the really irritated throat. But so we're usually looking at runny nose, sneezing, some congestion, some inflamed, red, itchy eyes, itchiness. And so that histamine reaction that you see from an irritant, your body's trying to get rid of the irritant, which is pollen. It's thinking, what is this foreign substance that you've put in your body? I'm trying to get rid of it. And your body tries to get rid of it through, mucus and runny nose, trying to get rid of that irritant.
So if it's right here, it's mainly a lot of times.
Usually, if you're just seeing stuff right here, you could have a sinus infection. When you start getting really inflamed and congested, stuffy, sometimes allergies, but that could be a viral sinus infection.
Okay.
But either way, the symptom treatment is typically the same because there's no cure for most upper respiratory viruses anyway. So, you just want to kind of be thinking whether you're contagious or not.
Right.
But otherwise, you're just treating some of the same symptoms. So, talking about treatment options, so you've got your most common allergy pill. An allergy medication is what we're typically recommended, especially if you have the runny nose and the sneezing. So your Claritin, your Zyrtec, your Allegra, your Zysol is somewhat of a newer one. Generic versions of all of those are out on the shelf, and so they're great options. I take usually generic Zyrtec if I have any symptoms like that.
So Zyrtec is a good.
Yeah, Zyrtec and Claritin are the most affordable generic options. Allegra is a little more expensive, and it doesn't really have any, higher level of effectiveness really. So generic Claritin or Zyrtec, and they're over the counter. So don't feel like you have to jump at the brand that's $40. You can get a generic for usually $5, and that's what I take. And so 24-hour pill, non-drowsy. They're second generation antihistamines, so they typically don't make you drowsy, so they're not going to interrupt
That's
your
good to know,
workday.
because we have to work. I mean, we're looking for something non-drowsy, so that's good to know.
So if you're thinking, let me get some Benadryl, the Benadryl is the first generation. That's going to make you drowsy.
Yeah.
And so, if you feel like that works really well for you, you might have to take it at night. But the best option for, non-drowsy is your second generation. They don't cross the blood-brain barrier, so they don't cause that drowsiness. But if you really are having some bad runny nose, sometimes I will recommend a first-generation antihistamine, especially if you're retired or you're not working or you can stay at home. And so I prefer chlorpheniramine, similar to Benadryl, but chlorpheniramine, you have to take it more frequently, every 6 hours, but it'll make you drowsy, but it really dries up that runny nose and runny, just mucus.
Yeah, and most people, if you're like me, you cannot stand a runny nose. That is the worst. And you're sitting in church and you can't.
You're just sniffing, you're blowing your nose. It's aggravating, and then your nose starts getting raw. So you can try the first generation like chlorpheniramine. Don't take both, Zyrtec and chlorpheniramine, but one or the other. Flonase is a good option, or some sort of steroid nasal spray. Helps with that inflammation and the runny nose and the congestion. If you're stuffy and you can't breathe, I really like a steroid nasal spray because it opens up the airways because there's inflammation going on in there. Another option if you're stuffy is Sudafed, pseudoephedrine. Little red pill that you might be familiar with. You have to get it behind the counter at a pharmacy. You can't just purchase it over the counter.
Okay.
It's not prescription, but it's kind of, the pharmacist or the pharmacy staff has to grab it for you and check your ID and that kind of thing. But that can really help with the congestion. It's a decongestant, and it's pretty effective. But it can increase your blood pressure and your heart rate slightly sometimes. So we don't recommend taking that late in the day, or it'll keep you up. And if you have heart issues, talk to your pharmacist or your provider before taking Sudafed, because like I said, it could increase your blood pressure and your heart rate, which could be dangerous if you have hypertension or maybe AFib, something like that. So those are kind of the core bundle. You can throw in a cough medicine if you have a cough. Usually the allergy pill will help with an allergy-related cough.
Okay.
Because what you're having is the runny nose and the postnasal drip.
Right.
Dripping into your throat. Drainage, what we say. Irritating your throat, scratchy throat. Usually the allergy pill will help, but you could use a cough suppressant. But your body's kind of trying to get you to cough up what's in there. So you're kind of suppressing your natural reaction. So, but there's plenty of options over the counter. You see a lot of stuff. One thing I did want to mention is you'll see a lot of decongestants over the counter, not the Sudafed, but where you can grab it and pay for it. There's a lot of NyQuils and Alka-Seltzer brands where they're marketed as decongestants. Most of them have phenylephrine in them. That's a decongestant that's been around a while. FDA panel just came out, been a few months now, with some data saying that phenylephrine is not effective.
Really?
at all. It does not provide any decongestant relief.
So go to something besides NyQuil. Everybody in the world wants to grab NyQuil.
And the reason for that, we joke about it, in the pharmacy space a little bit is it has diphenhydramine in it or doxylamine, which is your first generation drowsy antihistamines, and you can't really have all these symptoms if you're knocked out asleep.
Right.
And
right.
so if you're asleep and you're just zonked out, it's kind of hard to be aggravated by your symptoms because you're asleep.
Right.
And it is treating some of the allergy symptoms, but it's not always the best option. And NyQuil has a bunch of different flavors of different formulations under that brand name, so it's not necessarily don't take NyQuil. But if you're looking at something and you see phenylephrine in there and you're hoping that you'll get some decongestant relief, you might want to ask your pharmacist because
phenylephrine, remember that. Look at the label or ask your pharmacist, as we always say. They're your friend. And
it's because it's hard to wade through all these options, especially the combination products like the ones that have 3 ingredients in them, and they're marketed as cough and cold and flu. Ask your pharmacist to get the best combination of medications because there's a lot out there, and if you just shotgun it, you might be choosing the completely wrong thing for your symptoms.
Definitely.
And it's usually not harmful, but might not be helpful, and you might be wasting your money.
Well, you might want you also you want to make sure you're getting the right, as you said earlier, getting the right combination.
Yeah, there's just these so many different brands of these combination products. They'll have a cough suppressant, they'll have Tylenol in them, or ibuprofen.
Double up.
Yeah, and you might not be thinking you might get a cold and flu, has ibuprofen in there, and you're treating cold symptoms, and you're already taking an NSAID prescription similar to ibuprofen, or maybe you're taking a leave, and then all of a sudden you're doubling up on NSAIds. That can cause a GI bleed or hurt your kidneys. So just because it's over the counter doesn't mean it's 100% safe with your other medications. But the phenylephrine, it's not harmful, so don't be scared if you're taking something with phenylephrine. It's not harmful, just not very. It's not
if you're
effective.
going to take something, you want the benefit.
Yeah, and so if you want decongestant, I'm looking at Sudafed if you can take it safely, or your corticosteroid nasal spray is going to be your best bet. The allergy pills don't help a ton on stuffy congestion because they're designed to dry up, but what that does if you have a lot of green mucus is it kind of gunks up things. So that's another reason to talk to your pharmacist, because it really is about what symptoms you're experiencing, and we can quickly and easily guide you to the right drug. And so we love helping people and educating people on symptom relief and over-the-counter products. So don't always just jump at the first and cheapest thing you see, because your quality of life is important when it comes to allergy symptoms. So we want you to come talk to us, and we would love to help you at Medical Park Pharmacy over at 901 North Winstead Avenue in the Medical Park building, first floor, 252-443-7979. And if you don't have a local pharmacy or a pharmacist that you feel like you can have a relationship with, we would love to be that pharmacy and pharmacist for you.
What are your hours?
So 9 to 5:30 Monday through Friday, and we deliver throughout the Rocky Mount area for free. And so
that right there in itself is just a great thing.
So if you can't get to us, you're working, we can come to you at your workplace or to your home, and no extra charge. So
yes,
we try to accommodate folks any way we can, and we can line all your medications up to fill one time per month. And that's called our Med Sync program, Med Synchronization. So we line everything up one time a month and can deliver it to you, so you don't have to make 7 trips to the pharmacy a month picking up different prescriptions. So, and if you have a loved one that needs their medications sorted and packaged by date and time, we do that for free. That's our MacPack program. And we serve the Nash County, Edgecombe, Martin, Halifax County areas. And that's our pill pack program, and so easy to tear strip pouches with the date and time, the name and description of your medications, and we're automatically filling those every month and sending them out to to your door for free. So
can't get any better than that. And as we get older, you know, our memory might not be what it was sometimes, and we need to have this medication prepared for us. It's just so much easier. There it is. Get it out. You don't have to sit there and wonder, oh wow, do I take that this morning, tonight, you know, whatever. There's no wondering.
yeah, medication errors are one of the biggest drivers for hospital admissions and deaths. And so
Yeah.
it's nothing to, you know, leave up to chance and to stress over if you're worried about it, because our MacPack packaging program is free. You just pay your normal copays. We accept all major insurance plans. Your copay is typically going to be the same no matter what pharmacy you go to. So we would encourage you to use a pharmacy that's bringing value to you and convenience and safety and a personal relationship, somebody that you can count on and call and reach to answer your questions. So we would love to be your local pharmacy if you're looking for a new home, and if you're tired of the headache and hassle of a big chain pharmacy, there's a better option out there for you, and we'd love to help you.
Well, I had somebody tell me they went to a box store and the window was closed, and you know, it said don't have a pharmacist today, and I'm like, really? So I mean, there's a lot of
There's some issues going on.
advantages to an
Yeah.
independent pharmacy.
We're going to be there for you.
Yeah, absolutely, and that's what you need. So your pharmacist is your friend, and use them. So
Absolutely.
absolutely. Okay. Well, Thomas, thank you for being on today, and we'll see you in 2 weeks.
All righty.
Third
Thanks,
week of the
Sandra.
month.
Looking forward to it.
Absolutely. And we'll be right back with you with Roger and myself.